Welcome to the final of 4 webinars in this series entitled Designing for Behavior Change, a Human-Centered Approach to Research and Intervention. This series of webinars is brought to you by the Human-Centered Design Task Force of the American Heart Association's Healthcare by Food initiative and is part of the initiative's cooperative studies model designed to foster shared learning and innovation across the Healthcare by Food initiative. Before we get started, I need to share this important disclaimer. Statements, opinions, and study results presented in this presentation may not reflect the policy or science position of the American Heart Association unless otherwise noted. This fourth webinar, Personas in Action, Driving Insights for Behavior Change, will introduce a personas tool to the mix of tools and frameworks we've already introduced to help you generate additional actionable insights to inform your research strategy. In particular, we will apply the persona tools within the context of the COM-B and journey mapping tools we've already introduced. For this session, we'll introduce the personas tool to help prioritize individual needs, experiences, and perspective. You'll have the opportunity to develop and refine personas specific to your study and leverage them to generate additional insights to inform your research strategy, and then we'll apply them to the journey mapping and COM-B frameworks we previously introduced. Let's get started on personas. The persona tool is intended to help us orient around the human, to bring the person front and center. What are their needs, their goals, and the challenges your target population faces from their perspective? The way we approach this tool is to develop understanding and empathy for different segments of your target population by articulating their circumstances, priorities, and barriers. Let me start with 2 examples. Personas usually manifest in profiles that are aggregate characterizations of segments of your target population. They are compiled from multiple individuals but accurately capture real needs and circumstances. These cards shown here are a sample of a set of personas that were built to better understand the profile of patients who utilized a healthcare access program for the underserved. In this case, we included some demographic information to set context, but more importantly, characterize their living and family situation, how they managed or struggled to maintain care continuity across a fractured system of providers, and the resources that were most critical to their health management. The audience for these cards was the care system itself, who had been brought together to improve how they cared for individuals who often fell through the cracks in society. And the cards were meant to impress upon the providers how difficult it was for individuals with limited resources to navigate an incoherent system. This second set of sample personas was from a project where we were redesigning one of the very first public housing projects in the US, now with plans to integrate a health clinic. The personas helped us to better characterize not only what it felt like to live in a tight-knit but under-resourced community, but also how the residents dealt with health concerns individually and then with support from their community. The cards captured perspectives from 3 different generations, all living alongside each other, with common needs and interdependency, but sometimes widely varying views on approach and priority. As a set, it helped the real estate developers and the designers of the embedded health clinic understand how to leverage the strength of the community while also accommodating personal differences. For the Healthcare by Food initiative, we've been using this worksheet to help study teams develop a better understanding of their target population. There's a copy of this worksheet in the webinar assets, which I encourage you to download for your own use. In this worksheet, we ask you to start with an image that can be a visual anchor for this persona. It doesn't have to be a photo of a person, and in the case of HIPAA regulations, definitely don't use a real person's image unless you have permission to do so. But it can be a stock photo or an illustration. Capture some of the relevant demographics, but also that person's priorities, what matters to them in their life. This can be people, hobbies, or professional work. The body of the worksheet is divided into 3 sections. One about the individuals themselves and the factors that motivate them to pursue healthy behaviors, as well as the barriers that impede that pursuit. In the second section, we're interested in their context, the things and people that support and encourage the adoption of new healthy behaviors, and the challenges they face, again, things and people, that discourage new healthy behaviors. Finally, we ask about their relationship to food, which oftentimes includes their food heritage, as well as their habits around purchasing and consuming food. I'd encourage as a first exercise to see if you can fill out this worksheet for your core target audience and then generate a number of alternate personas that accurately represent the breadth of your audience. If you're interested in more depth on personas, we have included an FAQ in the deck, as you can see here, which includes a bit more context on personas, their applicability, and resources from peer-reviewed literature that you may find helpful. Feel free to pause this recording and work on your personas, and then resume this recording when you're ready. Welcome back. From the early pilot studies that were a part of the Healthcare by Food initiative, we compiled 3 personas as examples that might be helpful to you in understanding what personas might look like. We have, for the sake of descriptiveness, named them Overwhelmed Olivia, Widowed William, and simply Esme and Ali. I'm going to share a bit of a voiceover for each persona, starting with Olivia, so you can understand some of the nuance we've tried to capture. The first person we've called Overwhelmed Olivia. Olivia is a 37-year-old pregnant Latina woman who's classically a member of the sandwich generation. She lives in a multi-generational household with her mother, who has diabetes, her husband, and her 3 kids. She's actually a nurse by training, so in the health profession, which grants her a slightly more informed perspective with regard to food as medicine. She lives comfortably in a pretty diverse, up-and-coming, gentrifying urban neighborhood, and as is often the case for the sandwich generation, the pressures on her are one, a limited amount of time for all the things she wants to do and needs to do, and two, the pressure of caring for everyone around her, often to the detriment of caring for herself. Even so, she's motivated by caring for those folks that she is surrounded by and loves. She's energetic and healthy enough to pursue all the things that matter to her, including her career, but she's got a lot of competing priorities. One of the really difficult things for her is that she's a people pleaser and often avoids conflict, which makes her more prone to making choices that are not as healthy as they might be for her and her family. She has the benefit of support from a family physician that knows her and her husband and her children very, very well. And she is well connected socially, in particular using technology. She belongs to a WhatsApp social support group. Her challenges actually manifest in a lot of interesting behavior. When she runs out of time, she throws up her hands and resorts to things like cheap takeout or ready-made or easy-to-prep meals, which are not always healthy. Her children are subject to social pressure as well, and so she often defers to their unhealthy food preferences. And she's also worried about her mother's judgment. As a working mother, she doesn't get as much time as her own mother did with her children. And she's concerned about not just that, but also what her mother thinks of her cooking behavior and the way she feeds her family. She has a strong cultural heritage around food that is very tied to her Latino identity, and in that way, food is a communal source of joy and interaction. She gets recipes and suggestions from her sisters and loved ones. And because she's busy and because she's got a lot of mouths to feed, she often resorts to cooking the things that people are more likely to eat, even if they aren't the healthiest options. She also makes food in big batches because leftovers are useful for school lunches and for days where she doesn't have time to cook. This is who we've called Overwhelmed Olivia. And as a reminder, she's not a perfect characterization of any one single person, but as a persona, she does represent needs and attitudes that we encounter often and the challenges that they're facing. The second persona is an example of a person who's much more isolated. We call him Widowed William. He's a 73-year-old African American male who's been retired for a while now, but more sadly has been widowed for 2 years. And a lot of his food behaviors and challenges around food are related to that. He's been recently diagnosed with heart failure, which is his first chronic disease diagnosis, and he's having trouble contending with that. He lives sufficiently on Social Security and modest retirement savings. His real joy is in spending time with his nearby kids and their families, which includes his grandchildren. And as is the case with many individuals at this stage of life, he really wants to live independently. He's proud of being able to do so and not having to rely on others. Those are his motivations. His barriers are definitely the loss of his life partner. He's still grieving the loss of his wife. Interesting for William, food is often a refuge from that grief, and also food that he eats that's familiar is often a trigger to that grieving, which becomes a vicious cycle. He's actually an unaccomplished cook since his wife cooked for him most of his life, and he only knows a few recipes. He has the benefit of eating with his children occasionally, and he has healthy eating support from his Medicare plan, but he doesn't take advantage of it because he doesn't know how to. His real challenges are challenges that arise from habitual behaviors. He's very familiar with shopping at the grocery store, but very unfamiliar with actually deciding what to buy because he was always handed a grocery list by his wife, which he just acted on. Now he shops for himself. And he, more often than not, resorts to buying what is convenient, even if he's aware that it's unhealthy. Food for him is about enjoying life. So he eats what tastes good, and what tastes good are the flavors he grew up on. He grew up in the South with Southern cuisine, and he inherently knows that's not particularly healthy, but it is what brings him comfort. Because he's alone, and sometimes because he's not in the best of spirits, he'll skip meals. And then that exacerbates his eating behaviors because he'll subsequently binge on something that's familiar and comforting. The third persona is actually a young couple called Esme and Ali. Their persona is interesting because they come as a pair. Esme and Ali are young. They're earlier in their adulthood, earlier in their careers, but they are both struggling with inherited chronic conditions. They are a newlywed couple with different cultural backgrounds, and they're trying to reconcile all of that as they establish a life together. Food is a huge component of their social lives. It always has been, but that means they often eat out. And now, as they move in together and are trying to establish their own traditions and habits, they're struggling to figure out who's responsible for what. Esme has leaned in a little bit by doing some of the shopping, but it's not clear who's going to become the cook and who's going to scale either of those behaviors. Part of their barriers is the cost and affordability of the kind of food they like to eat when they eat out. It's expensive, but when they eat in, it's less so. The quality of food they prepare is not nearly as good as what they like to eat when they're out. The transition into life together is really their primary challenge, and reconciling different traditions around food. They're really committed to doing so, so they're eager to learn, and their habits are not yet fully formed. So they're actually quite open to influence. From the early pilot studies, we saw a number of fundamental themes emerge that might be interesting for you to consider. These are not meant to be authoritative, but rather a reference for you to reflect on. They will likely evolve and emerge as we learn more through additional studies. The first theme is about knowledge around nutrition, how to eat and what to eat. On the ends of the spectrum, you have those who are quite proficient, like in the case of Olivia. She actually does know what to do, and she's quite well informed. In the case of Esme and Ali, they're actually quite uninformed. They haven't figured out what to do, and the same is true for William as well. Motivation is very high for Esme and Ali. They're very encouraged, but that runs counter to their lack of knowledge. Olivia is very encouraged as well. William is a perfect illustration of someone who's discouraged. It does not bring him much joy to cook for himself, especially something he doesn't have the skills for. By individual effort, we mean how active you are in pursuit of healthy habits. You may have knowledge and you may have a lot of motivation, but you might still not actually be very active in that pursuit. There are those who are working actively to do that work. Esme is a good example. Others are idle, like William. Even if he had the knowledge, he might not muster the energy to actually act on it. Availability and affordability are real issues, especially for people who might fall lower on the socioeconomic spectrum. The opposite ends of that spectrum are the ease with which they can acquire and buy the food that they believe is good for them versus difficulty doing so. These are real issues for Esme and Ali. And then finally, time and circumstances. And I think the perfect example of this is Olivia. While she's well enabled and skilled, she has the means to do it, she really doesn't have the capacity to focus. For her, it really is time. She's very overloaded, and it's a rarity for her to have enough time to do all the things she wants, even for herself. These early thematic differentiators were found across many of the early pilot studies. I hope they provoke you to think a little bit about your own personas and how they would respond. I'd like to revert to the case study for which we showed you persona cards earlier to illustrate how personas may drive the design of your intervention. If you'll recall, one set of the personas we showed you previously was meant to characterize the behaviors and attitudes of residents of a public housing project being built with a modern embedded health clinic. Because the persona cards revealed two very distinct orientations to achieving and maintaining health, the design of the community and health clinic was very intentional about making specific accommodations for both. On the one end were individuals who were very functionally oriented. They required access and resources to manage their health and to enable their health behaviors because of serious economic and mobility issues. In response to their needs, the community offered services like access to fresh food. The local neighborhood was a food desert, but also care services delivered to and through the front door for those who were frail and unable to care for themselves. Other residents were more socially oriented, or at least relationship oriented. Much of their wellness depended on strong social connections with their community. Responses to their needs included community posting boards, communal outdoor spaces, and even convertible indoor spaces that allowed them to cook collectively for those who were less able to. In particular, this last community feature helped bridge the gap between the socially oriented and the functionally oriented by allowing the former to care for the latter. These interventions I've highlighted were developed directly in response to personas built from the original design research. I thought it might be helpful to see how design decisions arose from those early understandings. For this session, we have two additional exercises for you to consider. The first is about applying your personas across different stages of the journey. As a starting point, consider how each of the three personas we've introduced might respond to the demands of different stages of the journey. You can start with the food and meal planning stage of the journey map. As an extension, how are different stages of the journey harder or easier for the personas you might define for your own investigation? This third exercise is to utilize your personas to refine how you'll address issues of capability, opportunity, and motivation for your target audience. Do the different personas require different kinds of help? And how will you design that? For either of these two exercises, feel free to pause the recording to discuss with your colleagues and restart the recording when you're ready. Welcome back. As we conclude this webinar series, I hope you've learned a few things that were helpful to the design and execution of your study. We've introduced a number of perspectives and tools, and our hope is that they are helpful in developing your investigative studies further. As a departing thought, we found that many study designs focus tightly on traditional metrics, represented here as part of the iceberg above the waterline. That's not surprising because health conditions, demographics, and socioeconomic status are easy to define and measure, and genuinely less messy than what lies beneath the water. But as a core tenet of human-centered design, we encourage you to dive below the waterline to understand all the human elements that are often overlooked, are often the biggest determinants of success in what is ultimately a large-scale effort to change the eating behaviors of an entire population. Along with my collaborator, Natalie Prevet, it's been a privilege to share these perspectives with you. If you have any additional questions or want additional guidance, please don't hesitate to reach out. Our contact information is included in the deck available for download as part of this webinar's assets. Best wishes for your important work.